Good morning, everyone. My name is Ramona J Adrien. I'm a 26 years old Asian occupational therapist, and I'm one of the two recipients of the Dr. He Rosius Memorial Award from the 2021 NYSOTA conference. It's an honor for me today to share with you my journey as a freshly graduated OT up to now that I'm a master's candidate at Université de Sherbrooke in Canada. It's been a great experience working as an Asian OT in my country for about a year and a half. As one of the first Asian OTs to have graduated from a Haitian based program, I can tell you I have learned a lot about myself, my profession, and the people I cared for. I worked in both clinic and school setting, and I absolutely loved it. I've had the opportunity to work with children, adolescents, young adults, and adults, a variety of clients for a variety of diagnoses and conditions. As an occupational therapist, I've had to educate my patients about OT and what it stands for, and being an advocate led me to also educate parents on how to better support the person, child, youth, or adult they cared for. Where I worked, I had the opportunity to be in a multidisciplinary environment, working alongside nurses, doctors, psychologists, physical therapists, rehab techs, and teachers. I believe it was a golden mine for any OT student to actually have a taste of what it means to work as a team. Thinking back on my time as a student, I remember my subject for the memoir submitted to be able to graduate was about Down syndrome and parents' perspective of it. My goal was to measure their understanding of the condition, what they actually knew about the condition, and what they thought their child could do or couldn't do as a result of the diagnosis, and what hopes they had for their child in the future. Our results showed that there was a lack of knowledge and understanding, but that they had high hopes for their children's future. What also came out of the study is that parents had specific needs and demands for the government or any organization providing services to the population. They all wanted better care, inclusive services, and school programs. I personally enjoy talking to these parents about this subject, and our conversations during the interviews really strengthened my will to help and advocate for people living with disabilities in Haiti. Now that I am doing my master's degree in Sherbrooke, Canada, it's not really different. My project is actually a sub project of my ultimate goal. In Haiti, the school system is not really designed for everyone to succeed. It's mostly based on one's ability to learn by heart, which means memorizing, sometimes by the letter. This caused a lot of children to be retained until they passed all the subjects. And to me, it's always been unfair since I've been aware for a very long time that there can be many, many reasons why a student has difficulties in school. And it's just not because they're not smart. It could be stress, it could be PTSD, it could be anxiety, it could be because their home environment is prone to abuse, it could be malnutrition, and it could be because they have sensory issues. And thinking about all of this, I figured it would also affect student with special needs and student living with disabilities. I decided then to come up with a research project that would first establish a baseline knowledge of the actual reality for kids with special needs and living with disabilities in the school system. What the cultural perception is around their attendance and success in school, or what structures are put in place to help them learn and achieve something in school. Ultimately, my goal is really to come up with culturally adapted tools like interventions or evaluations and provide the Ministry of Health and the Ministry of Education or any other school program that would want to implement programs that could best support these children and these students in the school system. This tool would help actually establish whether the issue is sensory, psychological, behavioral, or cognitive. Let's say a 12-year-old had a pediatric stroke and they ended up with hemiplegia. I've had two patients with this diagnosis actually. And what happened to these kids, the school decided not to allow them to continue. And as for the parents, they didn't really see the need to send them back to school because they thought it would be a waste of money and a waste of time. But what if they knew there was another alternative? I believe having the tools to evaluate these kids and rule out or identify cognitive or sensory issues or other issues would then allow the schools, directors, professors, and parents to support them. Knowing there can be splits or adaptive devices to help with handwriting, for example, would give these kids a chance. Having other teachers and other teaching methods paired with OT interventions for those learning disabilities due to, let's say, I don't know, sensory integration disorder. This would give these kids a chance at learning. OT belongs in the school setting. OT has been proven to be efficient in collaboration with counselors and teachers and any other agent in the school system. Children with special needs and with disabilities deserve to have their spot in school, and I want to help my country get to that place where everyone is included. After my master's, even though I want to keep working with kids and advocate for them and their families, I still want to be able to become a professor at FSRL or any other OT program in the country. Because the next generation of Asian OTs will need Asian OTs with knowledge of the context, the culture, the values, and the customs to help them, to guide them as they navigate through this new field. Honestly, today I cannot express enough my gratitude for this opportunity to share with you. And it's been an honor. And now, if you have any questions, please do not hesitate to contact me. Dr. Offlin has my contacts, and I'm sure she will be happy to share them with you. Thank you.